In our last video, we looked at joints. We looked at the functional classifications and the structural classifications. The structural classifications are fibrous, where dense regular connective tissue holds them together, cartilaginous, where cartilage holds them together, and synovial, where you have a joint capsule. Then we have functional. Synarthrosis, and these are joints that don't move. Then you have amphiarthrosis, which can move a little, and then diarthrosis is freely movable. Now, the good news is the synovial joints are diarthrotic joints. The other ones, there's a little bit of mixing and matching. So, our fibrous joints had three types. We had sutures between the skull bones, the gomphosis, which is between the teeth and mandible and maxilla, and we have the syndesmosis. Now, this was the bad boy. This is the one that's actually slightly movable, so it would be an amphiarthrosis, and this is between the tibia and fibula and ulna and radius. So it's between the tibia and fibula, ulna and radius, and they are amphiarthrosis. These two are not movable, so they would be a synarthrosis. Now notice we have synovial, we have synarthrosis. There are going to be a lot of syns. It is a sin to confuse them. Our cartilaginous joints are symphyses and synchondroses. A symphysis has fibrocartilage, and it's between the vertebral discs and the two pubic bones. Now, this little flowchart's going to start looking like a conspiracy theory. A symphysis joint is also an amphiarthrosis. It is slightly movable. Think of doing some yoga poses. Now, the other type, the synchondrosis, is not movable. This is hyaline cartilage, so you have to know the cartilage type, and it's between the ribs and sternum, and the growth plate. And this, too, is a synarthrosis. So, one of these guys is the bad boy. I'm not sure which one to blame. But you need to know which joints are which type of joint. And again, we're going to do a matching out of the lab book as your follow-up for this. But I really suggest just writing this out. There's a lot of syns. Synarthrosis, you have syndesmosis, you have a synchondrosis, you have a symphysis. So there's a lot, and a synovial. So a lot of syns here. So a synarthrosis versus an amphiarthrosis. The amphiarthrosis are slightly movable. You can rotate your radius, that's the radius, around the ulna. During childbirth, the joint here, which you can't really see, moves, and the intervertebral discs give you movability during up dog, downward facing dog, cow, cat pose. A symphysis, and they include symphyses, those are the joints between your ulna and radius, and syndesmoses. The synarthrosis are not movable joints. They are the sutures, the gomphoses, and the synchondrosis. So this offends me. I want this one to be over here. I want this one to be over here. Nope. We don't have a perfect harmony. So, which joint would be the most stable? Shoulder, knee, ulna and radius, carpals in the wrist. Which one moves the least? Probably this one. We get a lot of discussion in class. The carpal, this is a sliding joint, this is a pivot joint. Symphysis joints have fibrocartilage, hyaline cartilage, elastic cartilage. Which one is it? Fibro. Which one has hyaline? The synchondrosis. Not in joints for elastic. The growth plate of long bone is technically hyaline cartilage joining the epiphysis to the diaphysis. Therefore, what two joint types would it be? Oops, there's choices. It would be a synchondrosis because it has cartilage, and it would be a synarthrosis because it's not movable. That would be very disastrous if that was a movable joint. The interosseous membrane between the ulna and radius is made of dense regular connective tissue and is slightly movable. Therefore, it is a Syndesmosis, suture, or synchondrosis. Syndesmosis. Oops. So see what I'm saying? You need to get all the syns straight. So we're going to look at synovial joints. You're going to be able to draw a synovial joint for lab, and you'll be able to explain the structures of it. You'll classify the ligaments based on location. And to be honest, I like going over the ligaments because they reinforce structures we learned in the last chapter. And you will identify which joints have fibrocartilage discs. A synovial joint is a freely movable joint, and they have a joint capsule. That means there's actually this space with synovial fluid in between them. So there's always a space between bones. Now, if you remember our long bones, there's this hyaline cartilage or articular cartilage that's going to reduce friction. So far, we have our articular cartilage over the bones, and we have a capsule between them. So what's keeping the bones apart? Well, there's this joint capsule. Now, the joint capsule is technically not the ligament. The ligament helps keep it together, though. But you have a membrane, and the membrane has two. We have this inner part that I drew in red that's going to make the synovial fluid. Then we have an outer fibrous part right here. So the fibrous layer in green holds it together. In pink or fuchsia, the synovial part makes the synovial fluid. So here is our picture. This is the synovial layer right there. That is going to make the synovial fluid that lubricates it in here. Then we have our tougher fibrous layer. This is not technically the ligament that's holding it together. This is holding the joint capsule in place. Now, these joints are movable. You basically need some sort of lubrication to keep bone from wearing down. So you have synovial fluid. It lubricates the joint. It provides nourishment for the cartilage. Remember, cartilage is avascular. And acts as a shock absorber when you do box jumps or something like that. The articular cartilage lines the surface of each bone, prevents friction. So these two things together are helping reduce friction inside the capsule. Now, we can have ligaments help hold it together. Most, if not all, of your synovial joints have ligaments. The ones that I can't think of specific ligaments are your planar joints in your hands and your feet. But they have two types of ligaments. Extracapsular ligaments would be outside the joint capsule. Intracapsular ligaments are within, and they both strengthen. Our intracapsular ligaments, we're going to have one go from there, one go from there. The other one come from back here. Wow, that looks like a cross. So these are intracapsular. And then we have ones going from the epicondyle here all the way down. These would be extracapsular. So that is our synovial joint. Other structures? A bursitis is where you've heard that term before. That's a sac-like structure between bone and skin or tendon and bone. It's basically like bubble wrap. A tendon sheath is an elongated bursa wrapping around a tendon to prevent friction. The most famous one is right here. It's the carpal tunnel. You have all these tendons going to your wrists, and I've had so many of my students that have worked at Starbucks or Pete's, and they all have carpal tunnel. So they're in your wrist. You also have one in your ankle. It's a very annoying one. I may have heard it. It was an overuse injury, running too much in old shoes, and it took 6 months to heal the bleepity bleep thing. So you have tendon sheaths, and if you have overuse of your wrists or your ankles, you get carpal tunnel or tarsal tunnel. So, you also have a fibrocartilage disc. That helps to help the two bones fit better. So, remember our tibia and fibula has two condyles? Well, condyles don't really want to fit with condyles. So you have a menisci in there. You have both a lateral and a medial that help the two condyles fit together. We're going to talk about the temporal mandibular joint, the TMJ. That also has menisces, and that lets you actually move your jaw in another direction. So they can allow two bones to fit tightly, they could increase stability, or add a little bit of mobility. So what is the role of the fibrocartilage disc? Fit better, additional motion, all of the above. So anytime you see something with all of the above and you know two of them are true, you know the third one has to be true too. So we're going to talk about the different types of joints in our synovial joints in our next videos and the range of motions. Thank you.